Okay, now we're going to talk on inflammation. Inflammation is an important process, but before we start, let's think on this. Is inflammation good or bad? Is inflammation good or bad? In fact, it can be both. Okay. Normal inflammation would occur in a human when the person appropriately inflames to what the general population would inflame to. Okay? Now that's good. All right. But if I had put some chalk on my skin and I inflamed to that, that would be abnormal. The general population would not inflame to that particular chalk. So that is what we could call an allergy, because I'm allergic to something the general human would not inflame to. Okay, let's go a step further. A bee sting. The average human should inflame to a bee sting. But if when the bee stung me on my hand, my whole arm swelled up, not just the hand puffed up like most, my whole arm, then that would be more of a hypersensitivity, because I would be over and above what normal inflammation. It could even be called an allergy because I'm doing more than the usual population. Okay? Now, on the other hand, suppose a bee stung me, or I had chalk on me, whatever, and I started to itch all over the body, swell up, and everything of that nature. That's what we call anaphylaxis. Now, anaphylaxis has many gradations. The worst gradation is when you suffer an anaphylactic response and all of a sudden your trachea starts shutting down on you and you can't breathe. So again, inflammation can be good or bad. Here we're talking about it in an appropriate normal. All right, so what can the inflammatory response do? Something that gets into the body, it can prevent the spread of it by walling it off. It can dispose of cell debris and pathogens. It can create an environment for white blood cells to attack and wall off. And it can also set the stage for repair. I encourage you to read on it. I'm not going to talk to you on hep C and ferroprotein, so we'll skip that. Here is the cardinal signs of inflammation, which many of you know. Redness, which also, learn a new term called erythema. Erythema, E-R-Y-T-H-E-M-A. That's redness. Heat, swelling, pain, and sometimes loss of function. Mike, where does loss of function occur? If you were to inflame around your elbow or your knee, the swelling would occur and you couldn't bend your elbow or your knee, which would essentially give a loss of function there. So the main ones are these four: redness, heat, swelling, and pain. Okay? We have certain things that will stimulate this inflammatory response. We have things called toll-like receptors. And these would be on macrophages and epithelial cells of certain tissues, respiratory and different things. And when a certain they're toll-like because they're looking for certain specific microorganisms, come by them, they then would internally turn on inflammatory chemicals inside the cell. Okay? Inflammatory mediators. What are the chemicals inside the cell? One is histamine. Histamine is a powerful vasodilator. Now let's think about that. A vasodilator, blood vessel opener, causes increased blood flow in that area. That would cause the area to get red, erythema. A lot of the blood flow would be coming from the core of the body. And remember, core blood is hotter than surface blood. That would give heat. Once the blood vessels dilate, fluid can leak out from the blood vessels, which could then lead to swelling. And then we have some neuroreceptors we're going to call nocioreceptors. 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 Look that up. Nocioreceptors are pain receptors. So when the swelling occurs, it could push on the nocioreceptors, and also inflammatory chemicals which could give the pain. So histamine is a powerful vasodilator. The two cells that, if irritated, can produce histamine are mast cells and basophils. Mast cells was in ANP1. They're tissue cells. Basophils in ANP2. Other proteins that can do it, histamine is really a modified amino acid from histidine, which is amino acid. Blood proteins can do it are called the kinins, the prostaglandins. The prostaglandins are from the eicosanoids. Look back in ANP1. The leukotrienes, which are also eicosanoids, and something called the complement system. Okay. Here again is a review of the eicosanoids. Look back in my ANP1 under the chapter 2, chemicals. Eicosanoids are produced from arachidonic acid, and they make several things through enzymatic action. Those that have heard of the NSAIDs, non-steroidal anti-inflammatory drugs, Motrin, Advil, that's what they do, is to block enzymes involved in this, to kind of take the edge off of inflammation. So this histamine and other chemicals, histamine, certain prostaglandins, can cause the dilation of blood vessels. Arterioles are types of blood vessels, resulting in hyperemia. Now that's another term. Erythemia, eryth means red, like erythrocyte. Hyperemia also means an increased blood flow, so a hyperemic response also is a word for red. I'm trying to teach you some clinical terms. The increased permeability of local blood vessels, capillaries, causes fluid to leak out. This fluid coming out also has some clotting factors in it, and it will attempt to wall off the microorganism. That's one of the jobs that will occur. So read your text also. The material coming out, which we'll call an exudate from the blood vessel, will also help move fluids into the lymphatic vessels, which we talked about previously. It'll deliver clotting proteins, which can wall off. But these clotting proteins, particularly fibrinogen, can also act like a scaffold in there, where repairing cells like fibroblasts can come in and start trying to repair the process after it's cleaned up. Okay. So that's looking at, now this gets to, if the inflammation was inappropriate, allergy, or was too much, hypersensitivity, then what do we have medically? We have the NSAIDs and the SAIDs. You've heard of these. The non-steroidal anti-inflammatory drugs, and then the steroid like cortisone and so forth. Here's a little discussion on NSAIDs. We have selective and non-selective. They're inhibiting an enzyme known as the COX enzyme. I'm going to go back here. The COX enzyme. See, the COX stands for cyclooxygenase. So by inhibiting that. Now, you have kind of two kinds. The COX, the selective and non-selective, just to bring it up. So here would be, you see in the COX-1, COX-2, Advil, Motrin. Those are non-selective. So they also inhibit some good stuff your prostaglandins do. Okay. The selective ones like to deal with arthritis and so forth. The only one left on the market is Celebrex. Others had too many side effects. So my point is, what is an NSAID? Non-steroidal anti-inflammatory drug. What does it do? Inhibit the production of prostaglandins, and prostaglandins can do a lot of stuff. The steroid anti-inflammatory drugs are far more powerful than the non-steroidal. And what they do is to come in and act way up high to prevent phospholipase A2. I'm just showing you. See, that's phospholipase. So you don't make any of the eicosanoids, the good or the bad. But they're very powerful. They also inhibit, let's go back here, they also inhibit chemotaxis, phagocytosis. So they really hold things off. Now, they will take that inflammation down, but they have a lot of side effects. The more powerful a drug is, the more side effects. The more powerful a drug is, the more side effects. So that's why we can only give it to you for a short period of time. Okay? Beta defensins is another in the armamentarium of your second line. These are produced by, let's say, neutrophils. You got the beta ones that are produced, okay, epithelial cells. The alpha ones, don't get too heavy on the defenses, but this is another set of chemicals, the alpha, the beta defensins, that can be used. We talked about phagocyte mobilizations, okay. Leukocytosis. So in phagocyte mobilization, leukocytosis, so this is still under the inflammatory action. What will happen is that the increase in blood vessel diameter, vascular permeability, will let fluid out. But it will also let out into that area a massive influx of white blood cells. That's what we call leukocytosis in that area. When it comes out, then what will happen is you will marginate, cling to the sidewalls with selectins. Diapedesis is a term how white blood cells squeeze through, and we mentioned this before, squeeze through the walls of the blood vessel. And we also talked on chemotaxis. So read in the book and also my PowerPoint to put the story together. So basically, the story would be this. Something happens to cause inflammation. Now, you can have sterile and non-sterile. If you hit your hand with a hammer, it's going to be inflammation too. It's just a sterile. But what will happen is that once you injure the area, you will irritate mast cells and basophils and other cells. Those cells will secrete chemicals. The chemicals will cause vasodilation. The vasodilation will increase blood flow to that area. The larger blood vessels, the holes in the vessels get larger to allow fluid to come out with clotting factors and white blood cells. The clotting factors wall it off. The white blood cells then have room to move around and try to attack the organism in order to do it. Some inflammation is good and some is bad. Some is good and some is bad. So kind of look at it and put the story together. I'm not going to. So here would be some pictures for you to look at. You can do that on your own to kind of see what I'm speaking of there. I'm going to end this PowerPoint because I want you to study it on your own and read the text too, whichever text you're using. And then we're going to do another one on what I call my antimicrobial proteins. So we'll come with that in a moment.